Procedure 3. Giving a complete bed bath. Reasons for giving a complete bed bath. 1. Ensures cleanliness of patients who cannot bathe themselves. 2. Promotes circulation. 3. Provides comfort. 4. Maintains muscle tone and joint mobility through active and passive movement. 5. Provides an opportunity for thorough assessment. Preparation. 1. Assess patient's ability to perform his or her own care. 2. Discuss patient preferences for bathing. 3. Provide privacy. 4. Avoid chilling the patient. 5. Wash your hands, wear gloves if you will come in contact with body fluids or handle a bedpan. 6. Gather all supplies in room before you begin. 7. Ask patient if he or she needs to use the median. 8. Check to see if patient is allergic or sensitive to soap. Special considerations. 1. Patients who need a complete bed bath are usually dependent in other ways also. They may need to be fed, be incontinent, or have devices such as IVs, feeding tubes, or multiple dressings in place. 2. The nurse needs to be comfortable manipulating these devices when giving the bath and ensuring patency and cleanliness of these devices. 3. It is always preferable to have the patient assist with the bath as much as possible, particularly with perineal care. 4. The bed bath is a good time to establish rapport and expand the nurse-patient relationship. 5. During and after the bath, the bed linen is changed, and the two activities are usually combined. Relevant nursing diagnoses. 1. Impaired bed mobility. 2. Bathing, hygiene self-care deficit. 3. Risk for disuse syndrome. Expected outcomes. 1. Patient expresses comfort and relaxation. 2. Skin is clean and dry. 3. Patient participates in the procedure as much as possible. Equipment and supplies needed for this procedure. 1. Basin of warm water. 2. Soap and soap dish. 3. Towels and washcloths, 2 or 3 of each, if possible. 4. Laundry bag or hamper. 5. Clean gown. 6. Clean gloves. Implementation. 1. Discuss procedure with patient and ensure privacy to promote cooperation and decreases anxiety. 2. Place all supplies within reach, organize task and prevents unnecessary steps. 3. Wash hands to reduce transmission of microorganisms. 4. Position bed at comfortable height to reduce nurse's back strain. 5. Fill basin with warm water, and test temperature on wrist to test temperature and help prevent accidental scalding. 6. Help patient to side of bed closest to you, and lower side rail to provide access to patient, and reduces back strain of nurse. 7. Remove patient's clothes while providing warmth and privacy with a covering such as a bed blanket to provides access to body parts, provides modesty and warmth. 8. Take washcloth and wrap the cloth around your hand tightly, forming a mitt to prevent splashing water on patient and bedclothes. 9. Be careful of the patient's eyes. Use clear water to clean them, starting from the inner canthus to the outer canthus. If patient is not sensitive to soap, lather washcloth and gently wash the patient's face, starting from the forehead down. Some patients are sensitive to soap or have very dry skin, and soap could increase dryness and lead to irritation and skin breakdown. Bathe from cleanest area and work downward toward feet, going from areas of cleanest to dirtiest. Attention to the eyes prevents eye irritation and infection. 10. Bathe ears and front and back of neck. Perspiration accumulates on the back of the neck when patients lie in bed for long periods. 11. Bathe upper body and extremities, stroking arms from wrist to shoulder. Include axillary area to stimulate circulation. 12. Soak hands in basin if indicated because dirt accumulates under fingernails, especially in incontinent patients. 13. Keep chest covered with towel and wash under breasts on female patients. Apply powder if patient desires, because this area stays moist on many females and can lead to skin excoriation. 14. Bathe abdomen using side-to-side strokes on skin folds because moisture and debris can accumulate in skin folds leading to irritation. 15. Bathe legs and feet being sure perineal area is draped to prevent unnecessary exposure. 16. Soak feet in basin if indicated, and if patient is able to hold leg in position because soaking will soften rough skin and facilitate cleaning toenails. 17. Change bath water if necessary because bath water may be cool or dirty. 18. Assist patient to side lying position and wash back. Give back rub. Side lying position gives access to patient's back for back rub. 19. Put on clean gloves and bathe perineal area and dry thoroughly to prevent cross-contamination of organisms. Excess moisture contributes to skin breakdown. 20. Remove gloves and assist patient to put on clean gown to promote dignity and reduces exposure. 21. Conduct other personal hygiene activities as needed to promote patient's body image. 22. Lower bed, raise side rails, put call bell in reach, and dispose of used equipment and linen to provide safety. Evaluation and follow-up activities. 1. Ask if patient is comfortable and feels refreshed. 2. Make sure bed is in low position, side rails are up, and call bell is within reach. 3. Replace all supplies, and put equipment where it belongs.